Hello there, and welcome to the Sleepy Science Society. Tonight, we drift along the banks of an ancient river, following the footsteps of healers who walked beside the Nile thousands of years before our time. We journey into a world where medicine was born from careful observation, where physicians recorded their knowledge on papyrus scrolls that would survive millennia, and where the art of healing balanced between the rationale and the mystical in ways that still fascinate us today. If you find peace in these quiet explorations of history and science, I gently invite you to like and subscribe. Your support helps others discover this calm corner where learning becomes a companion to rest, one sleepy soul at a time. But for now, simply settle in. Let your breathing slow. Allow the soft current of this story to carry you through time, back to the earliest days of medicine, when healers first began to understand the mysteries held within the human body. The ancient Egyptians developed one of the most sophisticated medical systems the ancient world had ever seen. Long before Greek physicians would lay the foundations of Western medicine, Egyptian doctors were performing surgeries, prescribing pharmaceutical remedies, setting broken bones, and documenting their observations with remarkable precision. They understood that wounds needed to be kept clean. They recognized the pulse and connected it to the heart. They performed complex procedures on the skull and spine, leaving behind records so detailed that modern doctors can follow their diagnostic reasoning across 4,000 years. As you rest tonight, imagine the warm Egyptian sun sinking below the horizon, casting golden light across the temple walls where physicians studied and practiced their craft. Picture scribes carefully recording medical knowledge in hieratic script, their reed brushes moving across papyrus in the flickering light of oil lamps. Feel the quiet dedication of healers who devoted their lives to understanding suffering and discovering ways to ease it. This is where we begin our journey, in a civilization that gave the world its first doctors, its first medical textbooks, and its first systematic approach to the science of healing, the dawn of medical knowledge. In the stillness before dawn, along the fertile banks of the Nile, a tradition was taking shape that would transform human understanding of health and healing. More than 5,000 years ago, as the Great Pyramids rose from the desert sands and hieroglyphic writing captured thoughts for eternity, the Egyptians were already documenting their medical knowledge, creating what would become the earliest recorded system of healthcare in human history. The first physician whose name survives in the historical record lived around 3,533 years before the Common Era. His name was Ra, and he served as chief physician and chief of dentists to the royal court. Carved into his tomb are depictions of his profession, preserving for all time the image of a man who dedicated his life to healing. But Ra was not alone. Egypt's medical tradition stretched back even further, into ages where knowledge was passed from master to apprentice through demonstration and oral instruction, before the written word could capture and preserve it. Yet, it is another figure who stands at the pinnacle of ancient Egyptian medicine, a man whose reputation as a healer was so profound that he would eventually be deified as a god. His name was Imhotep, and he lived approximately 4,800 years ago, during the Third Dynasty of the Old Kingdom. Imhotep served as the chief vizier to Pharaoh Djoser, and he was far more than a physician. He was an architect who designed the revolutionary step pyramid at Saqqara, the world's first monumental stone building. He was an astronomer, a philosopher, a poet, and a sage whose wisdom touched every corner of human knowledge. But it was in medicine that Imhotep's legacy would prove most enduring. Ancient texts describe him as the author of medical treatises that emphasized observation and rational treatment. He argued that disease occurred naturally, not as punishment from angry gods, though this view would coexist with spiritual interpretations of illness throughout Egyptian history. Temples were built in his honor, becoming centers of healing where the sick would come seeking cures. These temples served as early hospitals, places where medical knowledge accumulated and where healers learned their craft. By the time of the Greek period, more than 2,000 years after Imhotep's death, he was worshipped as the god of medicine and healing, revered alongside the Egyptian deity Thoth. The Egyptians understood something profound about the accumulation of knowledge. They recognized that wisdom must be recorded, studied, and transmitted across generations if it is to grow and evolve. And so they created institutions called Per-Ankh, houses of life, attached to temples throughout Egypt. These were not merely libraries, but centers of learning where scribes copied ancient texts, where scholars studied everything from astronomy to medicine, and where knowledge was preserved against the erosion of time. Physicians trained in these houses of life, learning from both written texts and experienced practitioners. Medical papyri served as their textbooks, containing case studies, diagnostic guidelines, and treatment protocols. These scrolls represented the accumulated wisdom of countless healers who had observed patients, tried different remedies, and recorded what worked and what did not. Each generation added to this knowledge, building upon the foundations laid by their predecessors. What made Egyptian medicine revolutionary was its systematic approach. Doctors did not simply react to illness with whatever remedy came to mind. They followed structured methods of examination, diagnosis, and treatment. When a patient arrived seeking help, the physician would conduct a thorough examination, asking questions about symptoms, observing the body carefully, and sometimes performing tests to determine the nature of the ailment. Only after this examination would a diagnosis be made, followed by a prognosis about whether the condition could be treated. The Egyptians categorized medical conditions into 3 types, a classification system that reveals their sophisticated understanding of the limits of their knowledge and capabilities. The first category included treatable conditions, injuries or illnesses that the physician felt confident addressing immediately. The second category consisted of what they called contestable conditions, where the outcome was uncertain. For these cases, the doctor would observe the patient over time, monitoring how the condition progressed before deciding whether intervention might help or whether the body would heal on its own. The third category included untreatable ailments, conditions so severe or so poorly understood that the physician recognized intervention would be futile. Even in these cases, however, doctors did not abandon their patients but offered palliative care to ease suffering. This remarkable approach to medical decision-making demonstrates a level of ethical thinking and practical wisdom that would not be widely adopted in other parts of the world for thousands of years. Egyptian physicians understood that doing no harm was sometimes the wisest course, that observing and waiting could yield better outcomes than hasty intervention, and that honesty about the limits of medical knowledge served both doctor and patient. The anatomical knowledge possessed by ancient Egyptian physicians came from a unique source. The practice of mummification, central to Egyptian religious beliefs about the afterlife, required priests and embalmers to work intimately with human remains. They removed internal organs, treated the body with natron and resins, and wrapped it carefully in linen. Through this work, performed on countless bodies over thousands of years, Egyptians gained direct knowledge of human anatomy that was unavailable to other ancient cultures. They could identify major organs: the heart, the liver, the lungs, the kidneys, the bladder. They understood that blood vessels connected to the heart and that the pulse could be felt at various points on the body. They recognized the importance of the brain, though they did not fully understand its function. Medical texts describe the meninges that cover the brain, the cerebrospinal fluid that bathes it, and even the pulsations that occur within the skull. Such observations, made more than 3.5 millennia ago, reveal minds capable of careful, systematic study of the human form. Egyptian medical knowledge spread far beyond the Nile Valley. Foreign rulers sought Egyptian physicians for their courts. The Greek historian Herodotus, writing in the 5th century before the Common Era, noted that Persian kings employed Egyptian doctors. Later, Greek physicians, including Hippocrates, often called the father of Western medicine, studied Egyptian texts and acknowledged their debt to Egyptian medical knowledge. The famous library at Alexandria became a repository for medical manuscripts from throughout the ancient world, including countless Egyptian texts that influenced later Greek and Roman medicine. As the night deepens and your body relaxes more fully, consider the profound gift these ancient healers gave to all who would come after them. They looked at suffering and disease not as incomprehensible mysteries, but as phenomena that could be observed, understood, and treated. They believed that knowledge should be written down, studied, and improved upon. They taught that healing required both skill and compassion, both rational thinking and respect for forces beyond human understanding. In doing so, they lit a lamp in the darkness, a flame of medical knowledge that has never been extinguished. The sacred texts, medical papyri. Imagine a scroll unrolling before you, 15 feet of ancient papyrus covered in elegant hieratic script. The text is written in black ink, with important passages highlighted in red, a system of notation that makes the document easier to navigate. As you read, you discover you are holding a surgical textbook, the oldest known surgical treatise in the world, a document so advanced in its thinking that it would not be surpassed in many respects for more than 3,000 years. This is the Edwin Smith papyrus, named not for its ancient author, but for the American antiquities dealer who purchased it in Luxor in 1862. Edwin Smith recognized the importance of this document, though he lacked the expertise to translate it. Upon his death, his daughter donated the papyrus to the New York Historical Society, where it lay relatively unnoticed until 1920, when the renowned Egyptologist James Henry Breasted began the painstaking work of translation. His complete translation, published in 1930, revolutionized understanding of ancient Egyptian medicine and revealed that rational, evidence-based medical practice existed far earlier than scholars had believed. The Edwin Smith papyrus dates to approximately 1600 years before the Common Era, but scholars believe it is a copy of an older text, possibly dating back to the Old Kingdom around 3,000 years before the Common Era. Some attribute the original work to Imhotep himself, though this remains speculative. What is certain is that the document represents accumulated knowledge refined over centuries by many physicians observing, treating, and learning from countless patients. The papyrus contains 48 detailed case studies, each following a precise structure that any modern medical student would recognize. First comes the title, identifying the type of injury or condition. Next, instructions guide the examining physician through a systematic evaluation of the patient, what to look for, what to ask, what to feel with the hands. Following examination comes the diagnosis, a clear statement of what ails the patient. Then appears one of 3 possible verdicts. This is a condition I can treat. This is a condition I intend to fight with, meaning the outcome is uncertain, or this is a condition that cannot be treated. For treatable conditions, the papyrus provides detailed treatment protocols. These instructions are remarkably practical and surprisingly modern in their approach. There are no magical incantations in most cases, no appeals to gods or demons, just clear, rational procedures based on observation and experience. The treatments include suturing wounds, applying bandages, immobilizing fractures with splints, using honey and grease to prevent infection, and providing specific herbal remedies for different types of injuries. The cases proceed systematically from the head downward through the body. The first section deals with skull injuries, describing in astonishing detail the anatomy of the head. The text identifies the cranial sutures, the seams where skull bones join together. It describes the meninges, the protective membranes surrounding the brain. It notes the cerebrospinal fluid and even mentions the pulsations that can be felt within the skull. These observations would not be rediscovered in Western medicine until centuries later. Case 12 describes a broken nose with remarkable precision. The physician is instructed to examine the patient, noting whether the nose is sunken and whether the nasal bones move loosely under the fingers. Blood flowing from the nostrils confirms the diagnosis. The treatment involves cleaning the wound, then packing the nose with 2 plugs of linen saturated with grease to hold the bones in position while they heal. This procedure, closed reduction with nasal packing, remains a standard treatment for nasal fractures in modern emergency medicine. Case 14 may represent the world's earliest recorded nasal reconstruction surgery. For a wound that has split the nose, the text advises you should draw together for him the 2 lips of the wound with stitching. After suturing, the wound is to be treated daily with fresh meat for the first day, then with grease and honey, and finally covered with lint. Each step serves a purpose. Fresh meat provides moisture and possibly some antibacterial properties. Grease creates a barrier against infection. Honey, as we now know, possesses powerful antimicrobial qualities that promote healing. The papyrus includes several cases involving fractures of the skull, some quite complex. Case 20 describes a severe injury, where the text notes changes in the patient's speech and walking. Recognizing that damage to the head can affect function in distant parts of the body. This observation hints at an understanding that the brain controls bodily movement and sensation, a concept that would not be fully developed for millennia. Particularly fascinating are the 6 cases dealing with spinal injuries. These descriptions are so precise that modern neurosurgeons can identify the specific level of spinal cord injury being described. Case 33 discusses a dislocation of a cervical vertebra, a neck injury. The physician is instructed to examine the patient and note specific symptoms: an inability to turn the head, pain radiating down the arms, weakness in the limbs. The text explains that this is a serious injury, but one that can potentially be treated. The recommended treatment involves reducing the dislocation and immobilizing the patient to allow healing. Case 48 describes lower back pain, and the diagnostic process walks through examining the spine, checking for tenderness, testing movement, and evaluating whether pain radiates into the legs. The rational, methodical approach to spinal injuries documented in this ancient text can still be recognized in modern clinical practice. The fundamental principles of careful examination, thoughtful diagnosis, and measured treatment remain unchanged across 40 centuries. Beyond the Edwin Smith papyrus, other medical texts reveal different aspects of Egyptian healing knowledge. The Ebers papyrus, dating to approximately 1550 before the Common Era, is longer and more comprehensive, containing over 800 remedies and treatments. Unlike the surgical focus of the Edwin Smith papyrus, the Ebers papyrus covers a vast range of medical conditions: skin diseases, digestive problems, parasitic infections, eye conditions, dental issues, and much more. The Ebers papyrus provides detailed recipes for medicines, specifying exact ingredients and proportions. Some remedies used common ingredients like honey, milk, and beer as bases for medications. Others incorporated exotic substances, frankincense, myrrh, precious minerals, and rare herbs. Each recipe included precise instructions, not only what to mix together, but how to prepare it, whether to heat it or leave it cold, how to administer it, whether as a drink, a poultice applied to the skin, a suppository, or an inhalation. The Kahun papyrus, dated to approximately 1900 years before the Common Era, represents the oldest known medical text from Egypt. It specializes in gynecology and women's health, containing 34 sections that address pregnancy, fertility, contraception, and various gynecological conditions. The treatments described are entirely non-surgical, relying instead on fumigation, massage, and medicines delivered in various forms. The text provides guidelines for how physicians should interact with female patients, how to inquire about symptoms sensitively, how to explain diagnoses clearly, and how to discuss treatment options respectfully. One striking feature of the Kahun papyrus is the attention it gives to what the text calls wandering womb, a concept where various symptoms throughout the body are attributed to displacement of the uterus. While this theory was incorrect, it reflects an attempt to understand how different parts of the body might influence each other, an early form of systemic thinking about health and disease. The Hearst papyrus focuses on treatments for urinary system disorders, blood conditions, and various types of bites and stings. Some of its remedies overlap with those found in the Ebers papyrus. suggesting that medical knowledge was shared and standardized across Egypt. The London Medical Papyrus, though poorly preserved, reveals more about the magical and spiritual aspects of Egyptian healing, containing numerous incantations alongside practical remedies. The Ramesseum papyri, discovered in the Great Temple complex of Ramesses II, consist of 17 individual documents focusing on eyes, gynecology, pediatrics, and treatments for muscles and tendons. These specialized texts suggest that Egyptian medicine had developed distinct fields of expertise, with some physicians focusing their practice on specific types of conditions or specific patient populations. What unites all these papyri is their methodical approach to medical problems. Each text organizes information systematically, making knowledge accessible to practicing physicians. Symptoms are described clearly. Diagnostic criteria are specified. Treatments are detailed with enough precision that another physician could replicate them. This commitment to recording and sharing medical knowledge allowed Egyptian medicine to progress over centuries, each generation building on the discoveries of those who came before. As you drift deeper into rest, these ancient scrolls float through your imagination like dreams. Picture the scribes who copied them, working by lamplight to preserve knowledge that might otherwise be lost. Imagine the physicians who consulted these texts, matching their patients' symptoms to cases described on papyrus, finding treatments that had proven successful in the past. Feel the connection stretching across time, from those ancient healers to the doctors of today who still follow the same fundamental principles of careful observation, thoughtful diagnosis, and evidence-based treatment. Surgical mastery and trauma care. Let your mind drift now to a scene more than 3,000 years in the past. A worker has fallen from scaffolding at a construction site, perhaps one of the massive building projects that defined ancient Egypt. His arm is clearly broken, the bone visible through torn flesh. He is carried to a physician, a man trained in the art of treating injuries, someone who has studied the medical papyri and learned from experienced masters. What happens next reveals the sophistication of Egyptian surgical practice. The physician begins with examination, not rushing to treatment but carefully assessing the injury. He notes the location of the fracture, whether it is open or closed, whether joints are dislocated, whether there is extensive soft tissue damage. He palpates the area gently, feeling for bone fragments and checking whether the limb retains normal sensation and movement. This systematic examination follows procedures laid out in medical texts. Procedures designed to gather all necessary information before deciding on treatment. Having examined the injury thoroughly, the physician proceeds to treatment. If the bone ends are displaced, he carefully manipulates them back into alignment, a procedure called reduction. This requires both knowledge and skill, understanding how bones articulate, knowing how much force to apply, recognizing when proper alignment has been achieved. Once the bones are properly positioned, the physician immobilizes the limb using a carefully constructed splint. Egyptian splints were remarkably well designed. Excavations have uncovered actual examples. Splints made from wood or reeds, carefully shaped to fit the contours of a limb, padded with linen to prevent pressure sores, and secured with bandages. The Edwin Smith papyrus describes splinting techniques in detail, explaining how to position the splint, how tightly to wrap it, and how often to check the limb to ensure circulation is not compromised. Some ancient remains show bones that healed with excellent alignment, testament to the effectiveness of Egyptian orthopedic techniques. For the open fracture where bone protrudes through skin, additional steps are necessary. The wound must be cleaned thoroughly to prevent infection. Egyptian physicians understood, even without knowledge of bacteria, that wounds exposed to dirt were more likely to become infected, and that infection could be fatal. They washed wounds with water, sometimes with beer or wine, which we now know contain antimicrobial properties. They then applied honey, a substance modern science has confirmed possesses powerful antibacterial effects through multiple mechanisms. Honey creates an acidic environment hostile to bacteria, draws moisture from bacterial cells through osmotic action, and releases small amounts of hydrogen peroxide that kill microorganisms. After cleaning and applying honey, the physician might cover the wound with a poultice made from various substances. Grease or animal fat formed a protective barrier. Certain herbs added anti-inflammatory or antimicrobial properties. Linen bandages held everything in place while allowing the wound to drain. The dressing would be changed regularly, with the physician monitoring closely for signs of infection, redness, swelling, heat, purulent discharge. If infection developed despite these precautions, the physician might apply additional remedies, or, in severe cases, might consider amputation to save the patient's life. Dislocations presented different challenges. The shoulder, hip, jaw, and fingers could all be dislocated through trauma. The Edwin Smith papyrus describes the reduction of a dislocated jaw in case 25, and the physician places his thumbs on the patient's lower molars and applies careful pressure, manipulating the jaw back into its socket. This exact technique is still taught in modern emergency medicine. Wall paintings from the tomb of Ipuai at Thebes show a physician treating what appears to be a dislocated shoulder, visual evidence confirming textual descriptions of orthopedic procedures. Head injuries received particular attention in Egyptian surgical texts, understandable given their frequency and severity. Skull fractures ranged from simple linear cracks to depressed fractures where bone fragments pressed inward against the brain. The Edwin Smith papyrus describes multiple skull fracture cases, including fractures of the skull base, the temporal bone, and the facial skeleton. For some cases, the papyrus recommends conservative treatment, rest, and observation. For others, particularly depressed skull fractures, the text implies that surgical intervention might be attempted, though details are limited. What is remarkable is the level of anatomical detail provided for head injuries. The text identifies specific cranial sutures, describes layers of tissue covering the skull, and notes the brain itself. Case 6 discusses a gaping wound in the head that exposes the brain, and the text carefully describes what the examining physician will see: the membrane covering the brain tissue itself appearing like the corrugations that form on molten copper, and the pulsations visible within the wound. These observations could only have been made by physicians who carefully examined such injuries, overcoming natural revulsion to study anatomy and understand what they were seeing. The treatment of burns demonstrates another aspect of Egyptian surgical expertise. The Ebers papyrus includes multiple remedies for burns with ingredients that modern research has validated. Aloe vera, used extensively by the Egyptians, contains compounds that reduce inflammation, promote healing, and provide cooling relief. Honey, again, prevented infection and created an environment conducive to healing. Certain resins provided protective barriers while adding antimicrobial properties. For burns, the papyrus recommends different treatments depending on severity. Fresh burns might be treated with a mixture of milk and barley flour to provide cooling and moisture. Once the initial inflammation subsided, honey or aloe-based ointments promoted healing. Severe burns that became infected received more aggressive treatment with antimicrobial substances, including copper compounds like malachite that are now known to have bactericidal properties. Wound closure represented another sophisticated surgical skill. The Edwin Smith papyrus explicitly describes suturing wounds to bring the edges together. Case 14's instructions, draw together the two lips of the wound with stitching, provide clear evidence that Egyptians practiced suture techniques. Archaeological evidence supports this, with some mummified remains showing signs of healed surgical incisions closed with sutures. The actual materials used for sutures probably included linen thread, animal sinew, or possibly even hair, materials that would have been readily available and sufficiently strong. Beyond acute trauma, Egyptian physicians performed other surgical procedures. They lanced abscesses to drain pus, understanding that allowing infected material to escape promoted healing. They removed superficial tumors and cysts. They performed circumcision, both as a religious ritual and as a medical procedure in cases of phimosis. Wall paintings and reliefs show medical instruments in use: knives, scalpels, forceps, hooks, and other tools that would not look completely out of place in a modern operating room. Perhaps most impressive was the Egyptian approach to surgical decision-making. They understood that not all conditions could be treated surgically. The Edwin Smith papyrus, in describing various injuries, sometimes concludes that a condition is untreatable, acknowledging the limits of surgical intervention. This honest assessment protected patients from futile procedures while allowing physicians to focus resources on cases where treatment might succeed. It also reflects a sophisticated understanding of surgical risk, the recognition that intervention itself carried dangers, and that sometimes the wisest course was to do nothing. Pain management during surgical procedures remains somewhat mysterious. Opium appears in Egyptian medical texts as a treatment for severe pain, though whether it was used as a surgical anesthetic is unclear. Some scholars suggest that wine or beer might have been used to dull sensation during procedures. Others propose that speed and skill might have been the primary methods of minimizing suffering, with experienced surgeons working quickly and efficiently to complete necessary procedures. As sleep draws nearer, picture the steady hands of an Egyptian surgeon at work. See the careful cleaning of a wound, the precise placement of sutures, the gentle wrapping of bandages. Feel the weight of knowledge accumulated over centuries, knowledge encoded in papyrus scrolls, passed from master to apprentice, refined through countless observations of what worked and what did not. These ancient surgeons understood something fundamental, that healing required both knowledge and compassion, skill guided by wisdom, and intervention tempered by an honest recognition of medicine's limits. The pharmacy of the Nile. The sun rises over the Nile, illuminating fields and marshes rich with plant life. Along the riverbanks grow rushes and reeds. In the shallows, lotus flowers open their petals to the morning light. Further from the water, acacia trees provide shade, while date palms sway in the breeze. The Egyptians looked at this landscape and saw not just beauty, but a vast pharmacy, plants and minerals and animal products that could be transformed into medicines to treat a remarkable range of ailments. Egyptian pharmaceutical knowledge was extensive and sophisticated. The medical papyri list hundreds of different substances used in healing, each with specific applications and preparation methods. Some of these remedies seem strange to modern sensibilities, but many have been validated by contemporary scientific research as genuinely effective treatments. Honey stands out as perhaps the most important substance in the Egyptian pharmacopoeia. It appears in countless recipes, used both alone and in combination with other ingredients. The Egyptians understood empirically what modern science has confirmed. Honey possesses powerful antimicrobial properties that help prevent and treat infections. When applied to wounds, honey creates an acidic environment with a pH around 3.9, hostile to most bacteria. It draws water out of bacterial cells through osmotic pressure, effectively desiccating them. Honey also slowly releases hydrogen peroxide through enzymatic action, providing continuous sterilization of the wound site. Beyond its antimicrobial effects, honey promotes healing through multiple mechanisms. It reduces inflammation, stimulates the growth of new tissue, creates a moist environment optimal for healing, and even reduces scarring. The Egyptians used honey for treating burns, wounds, ulcers, and skin infections. They mixed it with other ingredients to create ointments or applied it directly in its pure form. Some papyri specify particular types of honey for different conditions, suggesting an understanding that honey from different sources might have varying properties. Aloe vera, which grows readily in Egypt's climate, served as another cornerstone of Egyptian medicine. The thick gel contained within aloe leaves soothes burns, reduces inflammation, and promotes healing of damaged skin. The Ebers papyrus includes aloe in multiple remedies for skin conditions. Modern research has identified numerous bioactive compounds in aloe, polysaccharides that promote healing, antioxidants that reduce tissue damage, and anti-inflammatory agents that ease pain and swelling. The Egyptians may not have known the biochemical mechanisms, but they certainly recognized that aloe worked. Frankincense and myrrh, precious resins imported from distant lands, appear frequently in Egyptian medical texts. These aromatic substances were burned as incense in religious ceremonies, but they also had medicinal applications. Frankincense contains boswellic acids that reduce inflammation and may have pain-relieving properties. Myrrh has antimicrobial and antiseptic qualities. Both resins were incorporated into ointments for treating wounds and infections. They were also used in fumigation treatments, where patients would inhale smoke from burning resins, possibly to treat respiratory ailments. Garlic, that humble bulb so common in kitchens worldwide, was valued by Egyptian physicians for its medicinal properties. Workers building the pyramids were given rations of garlic, possibly because it was believed to increase strength and stamina. Medical texts prescribe garlic for various conditions: cardiovascular problems, infections, and digestive disorders. Modern research has revealed that garlic contains allicin and other sulfur compounds with genuine health benefits: cardiovascular protection, antimicrobial activity, and possibly immune system support. Willow bark appears in several papyri as a remedy for pain and inflammation. We now know that willow bark contains salicin, a compound that the body converts into salicylic acid, the active ingredient in aspirin. The Egyptians used willow bark preparations to treat headaches, fever, and inflammatory conditions. They also used it in poultices applied to joints affected by arthritis. The analgesic and anti-inflammatory effects they observed were real, the result of the same biochemical pathway that aspirin utilizes in modern medicine. The castor oil plant, which thrives in Egypt, provided oil used as a powerful laxative. The Ebers papyrus includes numerous recipes for treating constipation, many featuring castor oil as a primary ingredient. The oil irritates the intestinal lining, stimulating contractions that move contents through the digestive system. While modern medicine tends to favor gentler laxatives, castor oil remains in use for certain applications, testament to its effectiveness despite its unpleasant taste and sometimes dramatic effects. Pomegranate, both fruit and rind, served multiple medicinal purposes. The juice was used as an astringent for treating diarrhea and dysentery. The rind, rich in tannins, was dried and ground into powder for similar applications. Modern analysis confirms that pomegranate contains numerous bioactive compounds, polyphenols with antioxidant properties, ellagic acid with antimicrobial effects, and tannins that do indeed possess astringent qualities useful for treating diarrheal diseases. The Egyptians used various forms of copper in medicine, particularly copper flakes and malachite, a green copper carbonate mineral. These copper compounds were incorporated into eye medicines and wound treatments. Copper does have antibacterial properties. Ions released from copper compounds disrupt bacterial cell membranes and interfere with their metabolism. The Egyptians applied malachite-based cosmetics around their eyes, which may have provided protection against eye infections, a significant concern in a climate where flies could spread disease. Antimony, a metallic element, was ground into a powder and used in cosmetics and eye medicines. The black coal worn around Egyptian eyes was often antimony-based. While antimony compounds can be toxic at high doses, in small amounts they may have provided some protection against eye infections. The cosmetic practice of lining the eyes had medicinal benefits, a perfect example of how Egyptian culture integrated healing into daily life. Lead compounds appear in some Egyptian medical recipes, raising modern concerns given lead's toxicity. However, recent analysis suggests that the amounts used would have been too small to cause systemic lead poisoning, while potentially providing topical antiseptic benefits. The Egyptians seem to have stumbled upon a balance where beneficial effects outweighed toxic ones, at least for topical applications. Plant-based remedies extended far beyond these commonly used substances. The papyri mention hundreds of different plants, some readily identifiable, others more mysterious. Coriander seeds treated digestive problems. Juniper berries addressed urinary issues. Fenugreek seeds helped with various conditions. Cumin and caraway aided digestion. Each plant had its specific applications, and Egyptian physicians learned through centuries of experience which plants worked for which conditions. Animal products also featured in Egyptian pharmacy. Beef, mutton, and goat fat served as bases for ointments. Milk, both cow's and human, appeared in various preparations. Liver, rich in nutrients, was prescribed for certain deficiency conditions. Honey, of course, is an animal product, created by bees from flower nectar. Even more unusual substances found their way into medicines: dried beetles, gazelle dung, hippopotamus fat. While some of these seem bizarre, others might have had genuine medicinal properties, or at least served as harmless placebos that helped patients through the psychological benefits of treatment. Mineral substances provided another category of medicines. Natron, sodium carbonate, was used widely in mummification and also had medicinal applications. It could be applied to wounds as an antiseptic or taken internally for digestive problems. Various salts were prescribed for different conditions. Ochre, iron oxide minerals, appeared in some remedies, possibly providing iron supplementation for anemic patients. The preparation of medicines was itself a sophisticated practice. Ingredients had to be measured precisely, mixed in the correct proportions, and often processed through grinding, heating, fermentation, or other techniques to produce the desired form. Ointments required mixing dry ingredients with fats or oils to the proper consistency. Pills needed binding agents to hold them together. Liquid medicines might be mixed with beer, wine, or water to make them palatable and to aid in dissolving or suspending the active ingredients. Administration methods varied depending on the condition being treated and the properties of the medicine. Topical applications, ointments, poultices, and compresses brought medication directly to affected areas. Oral medications were swallowed, either as pills, as liquids drunk, or mixed with food. Suppositories delivered medicines directly to the lower digestive tract for conditions like hemorrhoids or for general absorption. Fumigation and inhalation brought aromatic substances into the respiratory system. Even eye drops and ear drops were precisely prepared and administered. The Egyptian approach to pharmacy demonstrated a sophisticated understanding of drug delivery and effectiveness. They recognized that the route of administration mattered, that some conditions required local treatment while others benefited from systemic medication. They understood dose-response relationships, knowing that the amount of medicine needed to be calibrated to the severity of the condition and the strength of the patient. They monitored treatment effects, adjusting medicines if patients did not respond as expected. As your breathing slows and deeper rest approaches, imagine walking through an ancient Egyptian garden dedicated to healing plants. Smell the aromatic herbs, the sharp scent of garlic, the sweet perfume of lotus flowers, the resinous aroma of frankincense. See healers gathering plants at specific times, understanding that harvesting at the right season or time of day might affect potency. Watch as medicines are prepared. Ingredients ground in mortars, mixed with precise amounts of honey or oil. shaped into pills or spread onto linen for poultices. Feel the accumulated wisdom. Generations of healers observing which plants helped which conditions, refining recipes, improving techniques, building a pharmacological tradition that would influence medicine for millennia to come. Specialized medical fields. Picture a crowded marketplace in ancient Thebes. Among the merchants selling bread and beer, pottery and textiles, papyrus and jewelry, you might find a different kind of practitioner setting up a workspace. This person carries tools and medicines, and a sign or announcement identifies their specialty. This is not a general physician, but a specialist, someone who focuses their practice on treating specific types of conditions or specific parts of the body. The Greek historian Herodotus, visiting Egypt around 440 years before the Common Era, wrote with amazement about the degree of specialization he encountered in Egyptian medicine. Each physician is a healer of one disease and no more, he observed. All the country is full of physicians, some of the eye, some of the teeth, some of what pertains to the belly, and some of the hidden diseases. This specialization, common in modern medicine but rare in the ancient world, reflects the sophistication of Egyptian medical practice. Ophthalmology, the treatment of eye conditions, was particularly well developed in ancient Egypt. The climate created perfect conditions for eye problems. Bright sunlight reflected off sand, and water could damage vision. Dust and sand blown by desert winds irritated eyes. Flies, ever present near the Nile, spread infections like trachoma, a bacterial disease that causes scarring of the cornea and can lead to blindness. Given these challenges, it is unsurprising that Egyptians developed specialized knowledge in treating eye conditions. The medical papyri contain numerous remedies for eye problems. Treatments for infections included washing the eyes with various solutions, milk mixed with honey, water infused with healing plants, or solutions containing copper compounds. For inflammation, soothing ointments were applied. Certain conditions were treated with fumigation, having the patient lean over smoking incense to allow vapors to reach the eyes. Some prescriptions seem to recognize different types of eye infections, requiring different treatments, suggesting an ability to diagnose specific conditions based on observation of symptoms. Trachoma, caused by the bacterium Chlamydia trachomatis, must have been a significant problem. The disease causes repeated infections that scar the inside of the eyelid, eventually turning the eyelashes inward to scratch the cornea with each blink. Egyptian doctors may have performed a simple surgical procedure to correct this, scraping or cutting the scarred eyelid to prevent further damage. While not curative, such intervention could preserve vision and reduce pain. Cataracts, clouding of the eye's lens that comes with age, were probably common. Whether Egyptian physicians attempted cataract surgery remains debated. Some scholars argue that references in medical texts suggest an operation called couching, where a needle is inserted into the eye to displace the clouded lens away from the line of sight. Others remain skeptical, pointing out that such surgery would have been extremely difficult without modern instruments and microscopes. The truth likely lies somewhere between. Perhaps some skilled physicians attempted the procedure in carefully selected cases while recognizing its high risk of complications. Dentistry represented another specialized field. Dental problems were widespread in ancient Egypt. The bread, a dietary staple, contained sand and grit from the stones used to grind grain. Chewing bread literally wore down teeth, and by Middle Age many Egyptians had severely abraded dental surfaces. This dental wear increased susceptibility to infections as the pulp cavity became exposed. Dental abscesses were common, painful, and sometimes fatal. The musician Giedmata Sank died around age 35 from a dental abscess that spread infection into the surrounding tissue and ultimately into the bloodstream. Dental treatment options were limited. The papyri describe remedies for toothache, mixtures to be applied to the affected tooth or gums to reduce pain and inflammation. Prescriptions included ingredients like myrrh, which has analgesic properties, mixed with honey or oil. For severe pain, opium might have been used, though evidence for this remains circumstantial. The instruction of Ang She Shank, a wisdom text, includes the maxim, "There is no tooth that rots yet stays in place," suggesting that infected teeth eventually fell out on their own, perhaps aided by the progression of infection that destroyed the supporting bone. Whether Egyptian dentists extracted teeth remains uncertain. No dental forceps have been definitively identified among Egyptian medical instruments, though some tools could potentially have served this purpose. Some skeletal remains show signs suggesting forced tooth removal, though whether this was therapeutic extraction or post-mortem ritual remains unclear. Replacement teeth have been found, sometimes real teeth attached to neighboring teeth with gold wire, other times artificial teeth made from ivory. Whether these prosthetics were functional or merely cosmetic, worn after death to ensure a complete appearance in the afterlife, continues to be debated. Dental wear was so severe and common that preventing it was impossible with available technology. The best sufferers could hope for was management of pain and infection when problems arose. The Egyptians did understand oral hygiene to some degree. Recipes for mouth rinses appear in the papyri. Mixtures of aromatic substances like myrrh, frankincense, and cinnamon mixed with honey. These would have freshened breath and possibly provided some antimicrobial benefit, though they could not prevent the mechanical wear caused by gritty bread. Gynecology and women's health received considerable attention. The Kahun Papyrus, the earliest known medical text from Egypt, focuses entirely on gynecological conditions. It addresses fertility problems, menstrual disorders, pregnancy complications, and various symptoms affecting the female reproductive system. The text demonstrates genuine medical observation, asking detailed questions about symptoms, examining patients systematically, and offering various treatment approaches. Egyptian physicians developed tests to diagnose pregnancy and even to predict the sex of the unborn child. One test involved having a woman urinate on wheat and barley seeds. If wheat sprouted first, the child would be male. If barley sprouted first, a female. If neither sprouted, the woman was not pregnant. Modern researchers testing this procedure found it could indeed detect pregnancy with reasonable accuracy, probably because pregnancy hormones in urine affected seed germination. The sex prediction aspect was, of course, no better than chance. Contraception was discussed openly in Egyptian medical texts, unusual for ancient societies. Various methods were described, some barrier methods that might have had some effectiveness, others that were probably ineffective. One prescription called for a mixture of crocodile dung, honey, and natron to be inserted into the vagina before intercourse. Whether this worked through barrier effects, creating a hostile environment for sperm, or simply by being so unpleasant that it discouraged intercourse entirely, remains a matter of speculation. Other contraceptive preparations used plant materials that might have contained natural spermicides. Childbirth was attended by midwives, professional women trained in assisting delivery. Birthing stools allowed women to deliver in a squatting position using gravity to aid the process. Medical texts describe signs of normal labor and warning signs that might indicate complications. They discuss techniques for managing difficult deliveries, including manual manipulation to reposition a baby or attempts to deliver a baby who had died in the womb. The risks of childbirth were very real. Maternal mortality was high by modern standards, and many women died from hemorrhage, infection, or complications during delivery. Specialized physicians also treated internal diseases of the abdomen. These physicians, sometimes referred to by a term translated as shepherd of the anus, dealt with digestive disorders, hemorrhoids, and parasitic infections. Proctology may sound like an odd specialization to modern ears, but digestive problems were common in ancient Egypt. Schistosomiasis, a parasitic disease transmitted through water contact, affected large portions of the population. The parasites live in blood vessels around the intestines and bladder, causing inflammation, bleeding, and organ damage. Egyptian physicians could not cure schistosomiasis, but they could manage symptoms with various remedies and procedures. Enemas and suppositories were commonly prescribed for digestive problems. The Egyptians believed that intestinal health was crucial to overall well-being, and regular cleansing of the digestive system was considered beneficial. Medical texts provide detailed instructions for preparing and administering enemas using various solutions, oils, herbs, or other substances depending on the condition being treated. Specialized instruments facilitated these procedures, including hollow reeds or tubes and funnel-like devices for introducing liquids. The specialization of Egyptian medicine extended to other areas as well. Physicians who focused on internal diseases of the chest, what we might call respiratory and cardiac conditions, are mentioned in some texts. Herodotus referred to doctors of hidden diseases, possibly meaning internal conditions that could not be observed directly. Military physicians accompanied armies into battle, becoming experts in trauma and battlefield injuries. Royal physicians served in palaces, treating the pharaoh and his family while possibly conducting research and teaching at attached medical schools. This degree of specialization required substantial infrastructure. Patients needed to know which specialist to consult for which problem. Specialists needed sufficient patient volume to maintain their expertise. Training systems had to exist to produce specialists with focused knowledge in their particular field. All of this suggests a well-organized medical system with clear referral pathways and recognized standards of practice. As sleep draws even closer, Imagine yourself in the hands of a skilled Egyptian specialist. Perhaps an eye doctor carefully applying a soothing ointment, explaining that daily treatment will be needed for several weeks. Or a dental specialist mixing an analgesic paste to ease the throbbing pain of an infected tooth. Maybe a gynecologist discussing pregnancy symptoms, offering reassurance and herbal remedies for morning sickness. Feel the confidence that comes from seeing someone who has devoted their practice to understanding one particular aspect of healing. Someone who has treated hundreds of similar cases and knows what works and what does not. Specialization represents medical knowledge becoming so deep and complex that no single physician can master all of it. A sign not of medicine's weakness, but of its strength and sophistication. The blend of magic and medicine. The boundary between the physical and spiritual was fluid in ancient Egyptian thought. The gods walked among mortals, or so the stories told. Divine forces shaped the world, bringing the Nile's flood each year, moving the sun across the sky, weighing hearts against the feather of truth in the afterlife. And so when illness struck, when pain came without obvious cause, when wounds festered despite treatment, Egyptians saw the hands of gods and spirits at work alongside natural processes. Egyptian medicine was never purely rational, never entirely divorced from religious and magical thinking. Even the most scientifically oriented medical texts, like the Edwin Smith papyrus with its systematic case studies, occasionally resort to magical incantations. The Ebers papyrus and other medical documents contain numerous spells intended to drive out demons, appeal to protective deities, or invoke supernatural healing forces. This combination of rational treatment and magical practice might seem contradictory to modern eyes, but for the Egyptians it was entirely logical. They were addressing illness on multiple levels, treating the physical body while also confronting the spiritual dimensions of disease. The goddess Sekhmet embodies this duality perfectly. She was simultaneously the bringer of disease and the healer of disease. A lioness-headed deity of terrifying power, Sekhmet could send plagues upon those who angered her, but she could also cure illness when properly appeased. Many Egyptian physicians served as priests of Sekhmet, undergoing training that included both medical knowledge and religious ritual. They learned surgical techniques and pharmaceutical recipes, but they also learned the prayers and offerings that would invoke Sekhmet's healing aspect while placating her destructive nature. Heka, whose name translates roughly as magic or magical power, was simultaneously a deity and a concept. Magic in the Egyptian understanding was not supernatural in our sense, something outside natural law. Rather, magic was part of nature, a force that could be harnessed through proper knowledge and ritual. Heka was the force that made creation possible, the power the gods themselves used to shape reality. When physicians invoked Heka, they were tapping into this fundamental creative and healing power, calling upon the same force that maintained cosmic order. The deification of Imhotep transformed a historical physician into a god of healing. By the time of the Greek period, temples dedicated to Imhotep served as healing centers where the sick would come seeking cures. Patients would sleep in the temple, and in dreams, Imhotep might appear to offer diagnosis or prescribe treatment. The actual priests and physicians working at these temples possessed genuine medical knowledge, and the dream revelations probably reflected the priest's observations of patients combined with their medical training. The divine framework made patients receptive to treatment, providing what we would recognize today as a powerful placebo effect that could enhance the effectiveness of actual medicines and procedures. Medical incantations served multiple purposes. At their simplest, they were a form of psychological support, providing comfort and hope to suffering patients. The ritualistic aspects of healing, the chanting of spells, the burning of incense, the presentation of offerings, created a therapeutic setting that helped patients feel they were receiving powerful treatment. Modern medicine recognizes that the setting and circumstances of treatment significantly affect outcomes. A patient who believes strongly in a treatment is more likely to experience benefit, even from treatments with no inherent physiological effect. Egyptian physicians, whether consciously or not, leveraged this psychological dimension of healing. Some incantations were directed at the disease itself, personified as a demon or evil spirit that had invaded the body. The spell would command the demon to depart, threatening it with divine punishment if it refused. Other spells appealed directly to gods, asking them to intervene on behalf of the patient. Still others were protective in nature, intended to create a magical barrier that would prevent disease from entering or returning. These incantations often accompanied practical treatments. A physician might clean and dress a wound, while simultaneously reciting a spell to drive out infection-causing demons. Certain conditions were seen as particularly spiritual in nature. Mental illness, seizures, sudden personality changes. These symptoms suggested possession by spirits or divine curse. For such conditions, magical and religious interventions might take precedence over physical treatments. Exorcism rituals attempted to expel possessing spirits. Protective amulets were worn to ward off supernatural attacks. Offerings were made to gods who might have been offended, seeking forgiveness and restoration of health. At the same time, physicians recognized that some mental symptoms were connected to physical causes. Head injuries, for instance, could change behavior, and these would be treated with appropriate medical procedures. The toothworm theory of dental decay illustrates how natural observation mixed with imaginative explanation. Egyptian physicians, like their counterparts in Mesopotamia, believed that tooth decay was caused by a worm living inside the tooth, burrowing through enamel and dentin, causing pain as it ate away at healthy tissue. Spells against the toothworm commanded it to leave, often with gruesome threats about what would happen if it refused. Modern understanding of bacterial action in dental caries shows the toothworm theory was incorrect, but it represented an attempt to explain observable phenomena, the holes that appeared in teeth, the progressive nature of decay. After reciting spells, Egyptian dentists would apply practical remedies, pain-relieving ointments, and antiseptic treatments, suggesting they understood that both spiritual and physical interventions might be necessary. Amulets played an important protective role in Egyptian medicine. These small objects, often shaped like gods or sacred symbols, were believed to channel divine protection. A person might wear an amulet of the Eye of Horus to protect against injury, or an image of the goddess Taweret to ensure a safe pregnancy and delivery. From a modern perspective, amulets provided psychological comfort, allowing wearers to feel protected and less anxious, Since stress and anxiety can affect physical health and recovery, the beneficial effects of amulets might have been more than purely psychological, even if the mechanism was not what the Egyptians believed. Dream interpretation formed another bridge between medical and spiritual practice. Dreams were considered messages from the gods, and disturbing or unusual dreams might be seen as warnings of impending illness. Medical texts sometimes discuss dreams as diagnostic tools. A particular kind of dream might indicate a specific disease or imbalance in the body. Priests trained in dream interpretation worked alongside physicians, and in some cases the roles overlapped. The healing temples where patients slept in hopes of divine dreams employed both priests who could interpret these dreams and physicians who could provide practical treatment. Fumigation with incense served both practical and ritualistic purposes. Burning aromatic resins like frankincense and myrrh created smoke that patients would inhale, potentially providing respiratory benefits. But fumigation was also a purification ritual, cleansing both the body and the spiritual environment. The smoke rising upward carried prayers to the gods while simultaneously driving away malevolent spirits. This dual function, physical treatment and spiritual cleansing, exemplified the integrated nature of Egyptian healing. Certain times were considered more auspicious for medical treatment: the phases of the moon, the position of stars, the festivals associated with particular gods. All these might influence when a procedure should be performed or when a medicine should be administered. While some of this was purely superstitious, other timing considerations had practical basis. Surgical procedures performed during cooler months might have lower infection rates. Certain plants harvested at specific times might have higher concentrations of active compounds. The balance between rational and magical approaches in Egyptian medicine shifts depending on which source we examine. The Edwin Smith papyrus is notably rational, with magic appearing in only a couple of cases out of 48. Other papyri, particularly the London Medical Papyrus, emphasize magical approaches more heavily. This variation suggests different physicians and different traditions balanced these elements differently. Some physicians might have been more empirically minded, focusing primarily on observable physical treatments. Others might have leaned more heavily on spiritual interpretations and ritual interventions. Patients probably sought out practitioners whose approach aligned with their own beliefs and the nature of their illness. What is crucial to understand is that Egyptian physicians themselves likely did not separate magic and medicine the way modern minds do. They lived in a world where the spiritual and material interpenetrated, where gods and humans, demons and diseases all interacted in a complex web. Treating disease meant addressing all dimensions of the problem. Physical treatments dealt with material symptoms. Spiritual interventions addressed the deeper causes and appealed to forces that could influence outcomes beyond what human hands could achieve. From their perspective, a physician who relied solely on physical treatment while ignoring spiritual aspects would be as incomplete as a modern doctor who treated symptoms while ignoring root causes. Let yourself drift now into that ancient worldview, where gods watch over human affairs, and where the seen and unseen realms touch. Imagine seeking treatment for an illness, receiving not just medicine but blessing, not just bandages but prayers. Feel the comfort of knowing that the most powerful forces in the cosmos are being invoked on your behalf. Whether the healing comes from herbs or from divine intervention matters less than the restoration of health. In this liminal space between waking and sleeping, perhaps you can sense what the Egyptians understood, that healing operates in multiple dimensions simultaneously, and that wisdom lies in addressing all of them. Medical training and practice. Morning light filters through narrow windows into a room attached to a temple. Students sit on reed mats, their attention focused on a scroll being read aloud by their teacher. The text is a medical papyrus, and today's lesson covers the treatment of skull fractures. The teacher explains each case carefully, describing the symptoms the examining physician should look for, the diagnostic conclusions that follow from those observations, and the treatment protocols that have proven successful in the past. Students take notes on their own papyrus sheets, copying the information they will need to remember when they become physicians themselves. This scene, replicated in houses of life throughout Egypt over centuries, represents the formal training of Egyptian physicians. The houses of life, Per Ankh in the Egyptian language, were institutions attached to major temples. They served as libraries, scriptoria where texts were copied, schools where various subjects were taught, and centers of intellectual life. Medicine was one of many disciplines taught at the houses of life, alongside astronomy, mathematics, theology, and other fields of knowledge. Medical training likely began with literacy. Students had to learn to read and write hieroglyphic and hieratic scripts, a demanding task given the complexity of Egyptian writing. Only after mastering written language could they begin studying the medical texts that contained centuries of accumulated knowledge. Some students entering medical training were probably the children of physicians, following a family profession. Others might have been talented young people identified and sponsored for advanced education. Still, others might have been temple servants or scribes who developed an interest in medicine. The core curriculum revolved around studying the medical papyri. Students would read and memorize case studies from texts like the Edwin Smith and Ebers papyri. They learned the proper structure for examining patients, what questions to ask, what physical signs to look for, how to formulate a diagnosis, and what treatments were indicated for different conditions. Repetition and memorization played a large role. Students needed to internalize vast amounts of information so they could recall it when examining actual patients. Practical training complemented textual study. Students observed experienced physicians at work, watching examinations, assisting with procedures, learning techniques through demonstration and supervised practice. A student might first practice mixing medicines, learning to identify different ingredients, measure proportions accurately, and prepare various types of remedies. Later, they might assist with wound care, changing dressings, applying ointments, helping to position patients during examinations. Gradually, under supervision, they would perform increasingly complex procedures themselves. Surgical training required particular care. A student learning to suture wounds would first practice on leather or animal hides, perfecting the technique before attempting it on human tissue. Reduction of dislocations and fractures required physical practice, learning how much force to apply and in which direction. Setting a splint properly demanded hands-on instruction, understanding how to position it, how tightly to wrap bandages, how to ensure circulation was not compromised. These skills could not be learned from texts alone. They required guidance from a master and opportunities to practice under supervision. Some medical training probably occurred on battlefields and at building sites where injuries were common. Military physicians accompanying armies would have seen numerous trauma cases, gaining experience that could not be obtained elsewhere. Construction projects, where workers faced risks of falls and accidents, provided opportunities for trauma physicians to practice their skills. A young physician attached to such settings would learn rapidly, confronted daily with situations requiring quick assessment and treatment. The length of medical training remains uncertain. Given the vast amount of knowledge to be mastered and the variety of skills to be developed, training likely lasted several years at minimum. Some specialties might have required additional study. An aspiring ophthalmologist would need to learn not just general medicine, but all the specific conditions affecting the eyes and the particular treatments for each. A surgeon specializing in orthopedics would need extensive practice setting bones and treating joint injuries. Examinations or certifications probably verified that physicians had achieved competence, though direct evidence for this is limited. Some inscriptions mention physicians holding official titles granted by the pharaoh, suggesting some form of formal recognition. The title chief physician implies a hierarchy within the medical profession, with senior practitioners supervising junior ones. Royal physicians, those serving in the palace, presumably were selected based on demonstrated skill and knowledge, creating a form of credentialing through royal appointment. Female physicians existed in ancient Egypt, a remarkable feature for the ancient world. The earliest known female physician, Meret Ptah, served as chief physician at the royal court around 700 years ago. Another prominent female physician, Pesachet, held the title overseer of female physicians during the Old Kingdom, suggesting she supervised other women doctors. The existence of female physicians indicates that women could receive medical training and practice professionally, though we lack details about whether their training differed from male physicians and whether they specialized in treating female patients or practiced general medicine. The medical profession appears to have been respected and relatively well compensated. Physicians received payment for their services, though how much and in what form varied depending on the patient's means and the physician's status. Royal physicians were salaried positions, with doctors receiving regular compensation from the palace treasury. Other physicians might work on a fee-for-service basis, or might be compensated in goods rather than money. Temple physicians might be supported by temple resources. In rural areas, payment might come in the form of grain, beer, or other necessities. Medical ethics, though not codified in a formal oath like the later Hippocratic Oath, clearly existed in Egyptian practice. The three-tier diagnostic system, treatable, contestable, or untreatable, represents an ethical framework. It required physicians to be honest about the limits of their knowledge and capabilities. The instruction that some conditions should be observed rather than immediately treated shows restraint and recognition that intervention could sometimes cause more harm than healing. The provision of palliative care, even for terminal patients, demonstrates a commitment to patient welfare that goes beyond simply attempting cures. The relationship between physician and patient appears to have been relatively egalitarian by ancient standards. The Kahun papyrus instructs physicians on how to speak with female patients, emphasizing clear communication and respectful dialogue. Medical texts sometimes indicate that treatment plans should be explained to patients, suggesting physicians did not simply impose treatments but worked collaboratively with those they served. House calls brought physicians to patients' homes, making medical care accessible to those who could not travel to temples or clinics. Physicians apparently enjoyed a degree of legal protection. Some evidence suggests that if a physician followed standard procedures documented in medical texts, they would not be held liable if the patient did not recover or suffered complications. This protection encouraged physicians to treat serious cases without fear of punishment if outcomes were poor, as long as they had adhered to accepted medical practice. It recognized that not all patients could be saved, and that medicine had inherent uncertainties. The organization of medical practice varied by location and setting. In major cities like Memphis and Thebes, medical care might be available at temple clinics where physicians saw patients, at private practices, or through house calls. In smaller towns and villages, access to trained physicians might be more limited, with medical care provided by healers with less formal training, or by priests who combined religious and medical roles. Military campaigns included physicians in their organization, ensuring soldiers had access to medical care. Building projects employed medical personnel to treat workers injured on site. Hospitals, in the modern sense of institutions where patients are admitted for extended care, probably did not exist. However, temples with healing functions served similar purposes. Sick people might come to these temples and remain for days or weeks, receiving treatment from temple physicians while appealing to the gods for healing. The healing temples of Imhotep and other medical deities functioned as early forms of hospitals, where patients received both spiritual and medical care. Professional societies or guilds might have existed, though evidence is limited. Physicians with similar specialties might have associated with each other, sharing knowledge and perhaps maintaining standards of practice. The title Overseer of Physicians suggests administrative structures within the medical profession. These supervisors might have been responsible for ensuring quality of care, training new physicians, and resolving disputes or questions about proper treatment. As consciousness fades and dreams approach, picture yourself among students in a house of life. The teacher's voice grows distant as sleep draws near. You have learned much today about treating skull fractures, about recognizing when intervention might help and when observation is wiser. Tomorrow brings new lessons, new texts to study, new techniques to practice. But for now, rest. Let the knowledge settle into memory, becoming part of the foundation upon which a lifetime of healing will be built. Understanding the body. The Egyptians stood at the banks of death and peered across into the mystery of the body. Their religious beliefs required preservation of the physical form for the afterlife, and so they developed mummification, a process that brought them into intimate contact with human anatomy. Embalmers opened bodies, removed organs, studied structures that in living people remained hidden beneath skin and muscle. From this work came knowledge that informed medical practice, an understanding of anatomy that, while incomplete by modern standards, was remarkable for its time. The heart held central importance in Egyptian anatomy and theology. They recognized the heart as a vital organ, different from all others in function and significance. The heart, they believed, was the seat of intelligence, emotion, and character. It was the organ that would be weighed against the feather of truth in the afterlife, determining whether the deceased was worthy to enter paradise. Medical texts describe the heart and recognize its connection to the pulse, the rhythmic beating that could be felt at various points on the body. Egyptian physicians understood that vessels, what we call arteries and veins, connected to the heart and spread throughout the body. They recognized that these vessels carried blood, and they noted the pulse traveling through them. The Ebers papyrus describes counting the pulse, using it as a diagnostic tool. Different pulse characteristics, fast or slow, strong or weak, regular or irregular, provided information about the patient's condition. This early understanding of the cardiovascular system, limited though it was, represents genuine physiological insight. However, the Egyptian understanding of what these vessels carried was confused. Some texts suggest vessels carried not just blood, but also air, water, urine, semen, and even tears. There was a concept called W, often translated as the channels or conduits of the body. These channels were thought to transport various substances to where they were needed. Disease could occur when these channels became blocked, or when harmful substances flowed through them in the wrong direction. This channel theory of physiology, while incorrect in details, represents an attempt to understand how the body functioned as an integrated system. The brain was recognized as an organ, and its importance was suspected. The Edwin Smith papyrus contains remarkably detailed descriptions of the brain's appearance, comparing its surface to the corrugations that form on molten copper, an apt description of the cerebral convolutions visible when the skull is opened. The text describes the meninges, membranes covering the brain, and notes the cerebrospinal fluid surrounding it. Most remarkably, some cases recognize that injuries to one side of the head could affect a function on the opposite side of the body, an observation that hints at understanding the brain's role in controlling bodily movement and sensation. Despite this knowledge, the brain was not considered particularly important in Egyptian theology or physiology. During mummification, the brain was usually removed and discarded while the heart was carefully preserved. The Egyptians did not understand that thought, personality, and consciousness originated in the brain. They attributed these functions to the heart, a misconception that would persist for millennia in various medical traditions. The liver, lungs, stomach, and intestines were all recognized as distinct organs with different appearances and locations. Their specific functions were not fully understood, but their importance was acknowledged. These organs were removed during mummification and preserved separately in special containers called canopic jars. The care taken in preserving these organs suggests the Egyptians understood they were essential to life, even if the mechanisms of their function remained mysterious. The kidneys and ureters were identified, and the connection between kidneys and urine production may have been recognized. The bladder was known, and physicians treated conditions affecting urination. The reproductive organs, both male and female, were understood in terms of their visible anatomy and their role in procreation. Though detailed understanding of reproductive physiology was limited. The Egyptian concept of conception and fetal development shows a mixture of observation and speculation. They understood that pregnancy resulted from sexual intercourse and that menstruation ceased during pregnancy. They recognized that pregnancy typically lasted about 9 months. They could sometimes determine pregnancy through examination of the belly, possibly detecting the enlarged uterus. Their pregnancy tests, using urine on grain seeds, while not scientifically valid by modern standards, show they were searching for physical signs that could confirm pregnancy early. The skeleton was understood to a degree. Bones could be felt beneath the skin and muscle. Broken bones revealed their structure when they protruded through wounds. Mummification exposed the full skeleton. Egyptian physicians recognized major bones like the skull, spine, ribs, and long bones of the limbs. They understood that bones provided the body's framework and that damage to bones could result in loss of function or deformity if not properly treated. Joints were recognized as special structures where bones articulated, allowing movement. The shoulder, elbow, wrist, hip, knee, and ankle were all understood to be joints that could become dislocated or damaged. Medical texts describe testing joint function to assess injuries, flexing and extending limbs to see if normal range of motion was preserved. This practical knowledge of musculoskeletal anatomy supported effective orthopedic treatment. Muscles, tendons, and ligaments were less clearly differentiated in Egyptian anatomy. These soft tissues were recognized as important for movement, but the detailed distinctions between muscle tissue, which contracts to produce movement, tendons, which attach muscles to bones, and ligaments, which stabilize joints, were not fully understood. However, practical understanding existed. Physicians knew that injuries affecting these structures could impair movement and that rest and support aided healing. The skin was understood as a protective covering that could be damaged by injury, burns, or disease. Its role in sensation, the ability to feel touch, temperature, and pain, was recognized. Medical texts describe testing sensation by touching injured areas with instruments to see if the patient could feel the contact. Loss of sensation indicated nerve damage, a serious sign that predicted poor outcomes for certain injuries. The nervous system, as we understand it, was not recognized by the Egyptians. They did not identify nerves as distinct structures carrying signals between the brain and the rest of the body. However, they observed that spinal cord injuries produced paralysis and loss of sensation below the level of injury. They noted that some head injuries affected the ability to speak or move particular limbs. These observations, documented in the Edwin Smith papyrus, represent early recognition that certain structures, even if not fully understood, played crucial roles in controlling bodily functions. The eyes received special attention. The anatomy of the eye, cornea, iris, pupil, lens, was partially understood. Egyptians recognized that the eye's various parts each contributed to vision and that damage to different structures produced different problems. They observed that some conditions affecting vision originated inside the eye itself, while others resulted from external injuries or infections. Respiratory anatomy was understood in basic terms. The nose, throat, and windpipe were recognized as the pathway for air. The lungs were identified as organs involved in breathing. Medical texts describe respiratory conditions, difficulty breathing, coughing, chest pain, though the physiological mechanisms of gas exchange were not understood. Treatments for respiratory ailments included inhalation of medicated vapors, oral medications, and poultices applied to the chest. The digestive system's anatomy was reasonably well understood from mouth to anus. The stomach's role in digesting food was recognized, though the detailed chemistry of digestion was unknown. The intestines were understood as structures where nutrients were absorbed and waste was processed. Physicians treated digestive problems with medicines taken orally, with enemas, or with suppositories, demonstrating understanding that treatment could be delivered at different points along the digestive tract. The urinary system's basic anatomy, kidneys, ureters, bladder, urethra, was recognized. Conditions affecting urination were common topics in medical papyri. Physicians could distinguish between different types of urinary problems: inability to urinate, painful urination, blood in urine, frequent urination, suggesting they understood these symptoms might indicate different underlying conditions. Female reproductive anatomy received considerable attention, unsurprising given the importance of fertility and childbirth. The uterus, cervix, and vagina were understood in basic anatomical terms. The connection between the uterus and menstruation was recognized. The changes in the uterus during pregnancy were partially understood, growing larger to accommodate the developing child, though the placenta and other structures were less clearly comprehended. Egyptian anatomical knowledge had significant limitations. They did not understand cellular structure or the microscopic organization of tissues. They could not see the fine details of organ structure that microscopes reveal. They did not understand biochemistry or the molecular basis of physiological processes. They misconceived the functions of several organs, attributing thought and emotion to the heart rather than the brain. Their concept of bodily channels carrying various substances reflected attempts to explain physiology without understanding circulation, respiration, or metabolism. Yet, within these limitations, Egyptian anatomical knowledge was substantial. It enabled effective surgical practice. It supported rational diagnosis based on understanding how injuries to specific structures produced predictable symptoms. It allowed physicians to explain disease and treatment in terms that reflected genuine understanding of bodily organization. This knowledge, transmitted to Greek and Roman physicians, influenced Western medicine for centuries. As sleep claims you completely, let your awareness drift through the body itself. Feel the heart beating steadily, sending blood through vessels that reach every tissue. Sense the lungs expanding and contracting, drawing in air with each breath. Notice the countless processes occurring beneath awareness: digestion, filtration, repair, all the functions that sustain life moment to moment. The Egyptians stood at the beginning of this understanding, peering into the body's mysteries with curiosity and careful observation. Their knowledge, though incomplete, represented humanity's first sustained effort to understand the intricate machine that carries consciousness through the world. Prosthetics, disability, and compassionate care. In a tomb at Thebes, archaeologists discovered a mummified woman whose left foot was missing. In its place, an artificial toe had been attached, carved from wood and leather with remarkable attention to detail. The toe had been carefully shaped to match the contours of natural toes, painted to approximate skin color, and attached with leather straps that would have held it securely to the foot. Biomechanical analysis of this prosthetic reveals something astonishing. It appears to have been functional, capable of bearing weight and assisting with walking, rather than merely cosmetic. This artificial toe, dating back approximately 3,000 years, represents the world's oldest known functional prosthetic device. It demonstrates something profound about ancient Egyptian society. They did not simply abandon people who had lost limbs or suffered permanent disabilities. Instead, they created technologies to restore function and integrate disabled individuals back into normal life as fully as possible. Other prosthetic devices have been discovered. A mummified woman from a later period wore an artificial big toe made of cartonnage, a material created from linen and glue. Experimental recreations of these ancient prosthetics, worn by modern volunteers, confirm that they could effectively aid walking, distributing weight more naturally than walking without the big toe, and reducing the characteristic limp that results from toe amputation. The devices were not perfect, but they genuinely improved mobility for their wearers. Prosthetic fingers, toes, and possibly other body parts were crafted with varying degrees of functionality. Some were purely aesthetic, designed to maintain the body's complete appearance for the afterlife. Others showed wear patterns indicating they had been used during life. The existence of these devices reveals craftsmen capable of creating sophisticated prosthetics and a medical profession willing to fit and maintain them for patients who needed such assistance. Disability itself was viewed through a remarkably progressive lens in ancient Egypt. Evidence from art, literature, and skeletal remains suggests that people with deformities, disabilities, and chronic conditions were generally integrated into society rather than marginalized or stigmatized. Dwarfism appears frequently in Egyptian art and records. People of short stature held respected positions, some as craftsmen whose small size allowed them to work in confined spaces, others as servants in wealthy households, still others as priests or officials. Far from being outcasts, they lived ordinary lives within their communities. Skeletal remains showing evidence of serious injuries that healed reveal people surviving traumas that easily could have been fatal. Healed fractures, including complex injuries to the spine and skull, indicate these individuals received medical care and were supported through lengthy recovery periods. People with conditions like poliomyelitis, which causes permanent paralysis and muscle wasting, lived to adulthood and old age, suggesting families and communities cared for them throughout their lives. Blindness, caused by disease, injury, or genetic conditions affected many Egyptians. Yet blind individuals worked as musicians, as storytellers, and in other roles where vision was less critical. A famous statue shows a blind harper performing at a feast, his disability noted but not presented as diminishing his value or dignity. Medical texts discuss treatments for eye conditions that might cause blindness, but when prevention or cure was impossible, the texts shift to discussing how to help patients adapt to vision loss. Deafness and speech impairments appear in Egyptian records. Sign language may have been used, though direct evidence is limited. People who could not speak or hear clearly still participated in family and community life. The lack of extensive discussion of such disabilities in medical texts might actually indicate they were not seen as medical problems requiring treatment, but as variations within the normal human condition requiring accommodation rather than cure. Mental illness and cognitive disabilities present more challenging interpretative questions. Ancient descriptions are difficult to match with modern diagnostic categories. However, evidence suggests that people with what we would recognize as developmental disabilities or mental health conditions were cared for by their families. Some temples offered sanctuary and care for people who were severely disabled or unable to care for themselves, an early form of institutional support. The three-tier diagnostic system used by Egyptian physicians took on particular ethical significance for chronic or terminal conditions. When a physician declared a condition untreatable, this did not mean abandoning the patient. Instead, it shifted care toward comfort and support, what modern medicine calls palliative care. Treatments aimed not at cure, but at easing suffering, reducing pain, managing symptoms, and maintaining dignity and quality of life as much as possible. Pain management, while limited by available technologies, was taken seriously. Opium appears in medical texts as a treatment for severe pain, though its use was probably reserved for cases where less powerful remedies proved inadequate. Herbal medicines with genuine analgesic properties, willow bark with its aspirin-like compounds, certain resins and ointments with anti-inflammatory effects helped manage chronic pain. Beyond pharmacology, physicians offered the simple but profound comfort of human presence, sitting with suffering patients, explaining what was happening, offering reassurance. Care for the elderly reveals another dimension of Egyptian compassion. Life expectancy was relatively low by modern standards, with many people dying before age 50. Those who survived to old age often experienced the physical challenges of aging, arthritis, dental problems, vision, and hearing loss, declining strength and mobility. Medical texts describe treatments specifically for conditions more common in older people. Families cared for aging relatives, and society valued the elderly for their wisdom and experience. Women's health across the lifespan received attention. Adolescent girls, pregnant women, new mothers, and women in menopause or old age all had specific health needs addressed in medical texts. Childbirth, extremely dangerous in the ancient world, received particular focus. When complications arose, physicians attempted interventions, though outcomes were often poor. When a woman died in childbirth, her surviving children were cared for by family or community, ensuring that maternal mortality did not result in complete family catastrophe. Children with disabilities or health conditions also received care. Pediatrics appears in several papyri, describing conditions affecting infants and children and offering treatments appropriate to young patients. Birth defects, childhood diseases, and developmental delays are discussed in medical contexts that suggest physicians attempted to help affected children and their families. While infant mortality was high, children who survived infancy were valued and protected. The social support structures enabling this relatively enlightened approach to disability remain partially obscure. Extended families probably bore primary responsibility for caring for disabled members. Religious institutions may have provided supplementary support. Some evidence suggests guilds or occupational associations helped members who became disabled, ensuring they and their families did not fall into complete destitution. The state itself may have provided assistance in some cases, though systematic social welfare systems as we understand them did not exist. Architectural evidence offers limited insight into accessibility accommodations. But the simple fact that people with mobility impairments survived and participated in society suggests some degree of accommodation must have existed. Homes and buildings were designed in ways that someone with a prosthetic limb or using a walking stick could navigate. Work was organized to include people whose disabilities prevented them from performing certain tasks, but who could contribute in other ways. Egyptian attitudes toward death and the afterlife may have contributed to their approach to disability. Religious beliefs emphasize the perfection of the body in the afterlife. Someone who died with a missing limb might be depicted in tomb paintings with that limb restored. The mummification process itself aimed to preserve the body as completely as possible. This theological emphasis on physical completeness in the afterlife paradoxically may have made Egyptians more accepting of imperfection in mortal life. What mattered ultimately was the soul's journey after death, not the body's condition during life. The relationship between physician and disabled patient appears to have been characterized by respect and realistic assessment. Medical texts instruct physicians to be honest about limitations, to explain when a condition cannot be cured, to discuss what adaptations might be possible. This honest communication, combined with commitment to patient well-being even when cure was impossible, reflects medical ethics that honored patient dignity, as you rest in the deepest stage of sleep. Imagine a world where disability did not mean exclusion, where people with conditions that could not be cured still lived valued lives. Picture craftsmen working with prosthetic devices, parents caring for disabled children, families supporting elderly members through final years. Feel the weight of compassion that sustained this approach, the recognition that every person held worth regardless of physical condition. The ancient Egyptians understood something modern societies still struggle to fully implement: that caring for the vulnerable reflects a civilization's true character, legacy, and influence. Time moves forward like the Nile flowing toward the sea. Egyptian civilization, which flourished for over 3,000 years along that great river, eventually declined. Foreign powers conquered Egypt. The Greek Ptolemies ruled, then the Romans, then others. The temples fell into disrepair. The hieroglyphic writing system was eventually forgotten, its secrets locked away until the 19th century, when scholars finally deciphered ancient texts. Yet, the medical knowledge of Egypt did not disappear. It flowed outward, carried by those who studied at Egyptian temples and learned from Egyptian physicians. Greek physicians traveled to Egypt to study. The great Hippocrates, often called the father of Western medicine, almost certainly had access to Egyptian medical texts. His systematic approach to patient examination, the careful observation of symptoms, the recording of case studies, all echo methods documented in Egyptian papyri centuries earlier. The Hippocratic Oath's emphasis on doing no harm and recognizing the limits of medical intervention reflects ethical principles present in Egyptian medical practice. Herophilos and Erasistratus, Greek physicians who made fundamental contributions to anatomy and physiology, studied at Alexandria in Egypt. The Great Library and Museum at Alexandria housed medical texts from throughout the ancient world, including extensive Egyptian documents. These Greek physicians acknowledged their debt to Egyptian medical knowledge, recognizing that they were building on foundations laid by earlier healers. Galen, perhaps the most influential physician of the Roman period, studied Egyptian medical texts and incorporated Egyptian knowledge into his own voluminous writings. Galen's works would dominate European medicine for over 1,000 years, and woven throughout them are threads of knowledge originating in ancient Egypt. Treatments for wounds using honey, the importance of cleanliness in preventing infection, the value of careful patient examination. All these practices traveled from Egypt through Greek and Roman medicine into medieval and eventually modern European medical traditions. The Islamic Golden Age saw another wave of Egyptian influence. As Islamic scholars translated Greek medical texts into Arabic, they encountered the Egyptian knowledge those Greek texts contained. Arab physicians traveling through Egypt studied ancient sites and texts that had been rediscovered. They preserved and expanded upon medical knowledge from multiple traditions, including important elements originating in ancient Egypt. When Islamic medical knowledge later reached medieval Europe through Spain and trade routes, Egyptian medical wisdom made yet another journey. Specific treatments pioneered by Egyptian physicians remain in use today, sometimes in modified form. Honey is now used extensively in modern wound care, particularly for burns and chronic wounds resistant to other treatments. Research has validated its antimicrobial properties and healing promotion. Willow bark's salicin led directly to aspirin, one of the world's most widely used medicines. Aloe vera appears in countless modern preparations for treating burns and skin conditions. Garlic's cardiovascular benefits, suspected by the Egyptians, have been partially confirmed by research. The structure of medical education reflects Egyptian influence. The concept of physicians training by studying texts and working under experienced masters originated in Egyptian houses of life. Medical specialization, with physicians focusing on particular types of conditions or body systems, was practiced in Egypt thousands of years before it became standard in modern medicine. The idea of systematic documentation, recording cases and treatments so future physicians can learn from past experience, was established in Egyptian medical papyri. The doctor-patient relationship, as we understand it today, carries elements that can be traced to Egyptian practice. The importance of explaining diagnoses and treatments to patients, involving them in medical decisions, maintaining confidentiality, and continuing a care even when the cure is impossible, all appear in ancient Egyptian medical texts. The Kahun papyrus's instructions for how physicians should communicate with patients foreshadow modern emphasis on informed consent and shared decision-making. Medical ethics, the principles guiding how physicians should practice and interact with patients, show Egyptian influence. The honesty about medical limits, the categorization of conditions as treatable or untreatable based on realistic assessment, the provision of palliative care for terminal patients, these ethical stances originated in Egyptian medicine and continue in modern medical ethics. The recognition that sometimes doing nothing is the appropriate course, that observation can be more valuable than intervention, reflects wisdom first, systematically articulated in Egyptian texts. The archaeological and scholarly work unlocking Egyptian medical knowledge continues. Modern technology allows analysis of ancient medicines, identifying their chemical components and testing their efficacy. Skeletal remains are studied with advanced techniques, revealing information about ancient diseases, injuries, and treatments that written texts alone cannot provide. Each discovery adds to understanding of how ancient healers practiced their craft and what they achieved. Some modern Egyptian traditional medicine practices may preserve very ancient knowledge, though separating genuine continuity from later additions or reinventions is challenging. Herbal remedies used in Egyptian folk medicine sometimes parallel prescriptions found in ancient papyri, suggesting possible transmission across millennia. Whether these represent continuous tradition or independent rediscovery remains debated. The fundamental approach of Egyptian medicine, observation, documentation, rational treatment based on evidence and experience, represents the true legacy. They established that medicine could be a science, based on systematic study rather than pure guesswork. They showed that knowledge could accumulate and improve across generations when carefully recorded and transmitted. They demonstrated that compassion and realism could coexist in medical practice, with physicians simultaneously striving to heal while honestly acknowledging limits. Modern medicine surpasses ancient Egyptian medicine in countless ways. We understand anatomy, physiology, and disease mechanisms far more completely. Our surgical techniques are vastly more sophisticated and safer. Our pharmaceuticals are more targeted and effective. We can treat conditions that were universally fatal in the ancient world. Yet the distance traveled from Egyptian medicine to modern medicine should not obscure the profound debt we owe to these ancient healers. They lit the first lamps in the darkness, illuminating the path that all subsequent medical advances would follow. When a modern surgeon examines a patient systematically before deciding on treatment, she follows protocols established in the Edwin Smith papyrus. When a doctor explains a diagnosis honestly and discusses treatment options, he practices communication emphasized in the Kahun papyrus. When nurses clean wounds with antiseptic and apply honey-based ointments, they use methods documented in the Ebers papyrus. The direct line of transmission may be obscured by millennia and multiple intermediaries, but the connection exists. Perhaps most importantly, Egyptian medicine established that healing is a worthy pursuit for human intelligence and effort. The elaborate systems of training, documentation, and practice they developed showed that medicine could be a professional calling demanding the highest levels of skill, knowledge, and ethical commitment. Every physician practicing today, every medical student studying late into the night, every researcher working to understand and cure disease, stands in a tradition that began in the temples and houses along the Nile, where ancient healers first systematically studied the art of healing. Closing reflection. The story of ancient Egyptian medicine draws to a close as dawn approaches. You have traveled far tonight, back more than 4,000 years to witness the birth of medical science. You have walked with physicians along the banks of the Nile, studied in houses of life, examined patients using methods documented in papyrus scrolls. You have seen surgical procedures that remain effective today, learned of medicines whose efficacy modern science has validated, and discovered ethical principles that continue to guide medical practice. What strikes most profoundly about Egyptian medicine is how it balanced multiple dimensions of healing: the rational and the spiritual, the practical and the compassionate, the accumulation of knowledge and the humble recognition of ignorance, all coexisted in their approach to healing. Modern medicine, for all its advances, still struggles to maintain this balance. We excel at technical intervention, but sometimes lose sight of the whole person. We accumulate vast knowledge, but occasionally forget that uncertainty remains central to medical practice. We develop powerful treatments, but may neglect the simple human comfort that comes from caring presence. The Egyptians understood that healing requires both knowledge and wisdom, both technical skill and ethical commitment. They knew that not all patients can be cured, but all patients deserve care. They recognized that honesty about medical limits serves patients better than false promises. They integrated disabled individuals into society rather than marginalizing them. They recorded their knowledge for future generations, showing that progress depends on learning from the past while building toward the future. As you drift in the peaceful space between waking and sleeping, perhaps you can carry forward some small piece of what ancient Egyptian healers understood. When you face suffering, in yourself or others, remember that healing has multiple dimensions. When you encounter medical knowledge, honor both its power and its limits. When you meet someone with disability or chronic illness, remember that human worth transcends physical condition. When you observe the world, know that careful attention and documented experience can expand understanding across generations. If this your journey through ancient Egyptian medicine has brought you insight or peaceful rest, I invite you once more to like this video and subscribe to the Sleepy Science Society. Your support allows these quiet explorations of science and history to reach others who seek knowledge that calms rather than agitates, who want to learn while drifting toward rest. Share your thoughts in the comments if you feel moved to do so. Tell us what aspects of Egyptian medicine surprised you, or what connections you see to modern healing. But now, let everything fall away. The physicians and temples, the papyri and procedures, the medicines and surgeries all fade into the background as sleep claims you completely. Your breathing slows. Your body relaxes into perfect stillness. Thoughts dissolve like mist in morning sun. You have learned much tonight, and that knowledge will rest gently in memory, available when you need it, but causing no disturbance to your sleep. The ancient Egyptians believed that night was a journey through the underworld, a passage from sunset to sunrise that mirrored the soul's journey from life to afterlife and back again. Let your own night now be such a journey. Travel through dreams and darkness, knowing you are safe, knowing morning will return, knowing that the wisdom of healers long past still guides those who care for the living today. Rest now. Let go. The Nile flows eternally, carrying the stories of those who lived along its banks into the endless future. Among those stories, the tale of ancient Egyptian medicine shines brightly, a testament to human compassion, curiosity, and the enduring desire to ease suffering and restore health. This gift they gave to the world remains vital after 4,000 years, a healing knowledge that transcends time. Sleep well, dream peacefully. Good night.